Diabetes and obesity are on the rise among young adults in the U.S. That's according to a new study. The two are risk factors for heart disease. News4Jax reporter Marilyn Parker spoke with doctors in our area about the study conducted to gather this data.
A study of 13,000 people ages 20 to 44 found a rise in diabetes and obesity. During the time frame of the study, obesity climbed from 32.7% to 40.9%. The data comes from the American Medical Association. Researchers at Harvard Medical School and the Washington University School of Medicine released the study Sunday. They found more young adults are at a greater risk of stroke, heart failure, heart attacks, and potentially fatal in lifetime of health concern. Dr. Trishella Johnson-Foy says the data is concerning.
We've already lost so many young people through the COVID pandemic. And so now you're adding this risk factor and this likelihood of them having heart disease at an earlier age. And so for our community, that is something that is definitely concerning, something that makes doctors get a little bit more on high alert because we want people to live long and healthy lives.
The study dives into the cardiovascular risk factors across racial and ethnic groups, specifically Black, Hispanic, and Mexican Americans. Hypertension in young Black adults was more than 2 times higher than in all other racial and ethnic groups, with no improvement over the study period. It says the etiology of these inequities is multifactorial, but likely includes disparities in early life exposures, access to health care, and other factors rooted in structural racism. Mexican American young adults also experienced a rise in diabetes. The study says this is especially concerning because there are high rates of undiagnosed diabetes in this population. We asked Dr. Foy what can be done about this.
I want patients to just hone in on the things that they can do themselves. They want to make sure that they start making healthy food choices, eating at least 5 fruits and vegetables a day, doing those things, eating foods that are high in fiber, low in fat, preparing their foods properly, not eating as much fried food, trying to make sure that we're eating as healthy cuts of meat as possible if they're going to be meat eaters. Exercising 30 to 45 minutes, 5 days a week is a good amount of exercise to keep that heart healthy.
Solutions provided in this study include community-informed, culturally appropriate public health efforts to address the rise in diabetes, addressing socioeconomic factors like poverty and access to insurance or primary care, and creating more green space for exercise. In Jacksonville, Marilyn Parker, Channel 4, the local station.